Well, okay, so it's 1 minute past, so we will make a start. So thank you to everyone who's joined our webinar this afternoon. Really appreciate you taking your time out today, and we hope we're going to give you some really good content around retention and recruitment today. So my name is James Pratt. I am the Health and Social Care Specialist at Tribepad. So I work with organisations to look at recruitment processes and how we can improve them through tech. I'm joined today by two fantastic panel members who are here on this first slide. And just to introduce you to those, so going from left to right, we've got Rowan Marriott. So Rowan has 20 years of recruitment experience, working throughout across employer brand, media buying, programmatic advertising, training and coaching as well. Rowan was head of resourcing for Signet Healthcare, a 10,000 employee organisation for over 4 years, and oversaw transformation in their recruitment processes. And then in August 2022, he launched Audience Link. So Audience Link prioritises working with organisations to improve and streamline their recruitment processes and give meaning and support to the search for meaningful applications. I'm also joined by Paul Lundbeck today. So Paul is Director of People Services at the HCRG Group. Paul's worked in HR for 20 years, predominantly in healthcare, fitness and wellbeing, and the charity sectors. And Paul recently played a key role in the rebranding of Virgin Care to the HCRG Group. So we've got two kind of broad topics that we're going to discuss today. But before we do that, I just want to tell you a little bit about Tribepad, who are hosting the webinar today. So Tribepad is a talent acquisition software provider. Our mission is to produce fantastic, configured, intuitive talent acquisition technology. And we've been around for 13 years, predominantly grown through referral, and we are a highly ethical partner that focuses on delivery and working together with our partner organisations in order to implement some fantastic technology. These are some of the organisations that we work with in the health and social care sector, potentially some familiar brands there. Again, if anyone on the call wants to discuss how we can potentially help, please do get in touch after the call. So to start the webinar, I thought I'd start with a little bit of context, in particular kind of looking at the health and social care sector. We know there's a number of push and pull factors from a recruitment perspective that are taking place at the current moment in time. Just to set the scene overall, we know there are 165,000 current vacancies in the sector, according to Skills for Care. We know there are some challenges around pay rates. So you can see here the kind of the middle figures, the Indeed average pay rates for personal care assistants, healthcare assistants, home assistants versus, say, the top rate of pay for a barista at Pret a Manger. We know we've got some retention challenges too. So 50% of carers under 20 leave care within 12 months. So while we do have some kind of headwinds in there and there are some push factors, we do also know in health and social care we've got some significant pull factors. And those are things around the experience of being a carer. So we know it's emotionally rewarding work. We know that you get the opportunity to build bonds with individuals that are incredibly powerful. It's an all-encompassing role, take you completely away from your personal troubles, and you focus on delivering fantastic, essential work for the customers and service users that you're working with. We know it's an opportunity to engage with wonderful people, and dare I say, in a much more meaningful way than, say, serving a coffee or a sandwich. And we know also it's answering a deep calling to help people in need. And hopefully from a job satisfaction perspective, it can give a sense and a feel of job satisfaction that a lot of other professions can't. So the first topic we're going to talk about is EVP and how do we stand out from our competitors in what we know is a really competitive marketplace. I'm going to come to Rowan first on this. Rowan, potentially be worth, if you wouldn't mind, kind of defining what you think is is EVP and potentially why you think it's important.
Yeah, fine, thank you, and hello everybody. Thanks for the intro, James. So an EVP, or employee value proposition, or the people deal, or from a candidate's perspective, what's in it for me, I suppose is best defined, or starting to define it by where it's placed, I suppose. So most organizations have a vision and a mission. So for a healthcare organization, the vision might be to be the biggest healthcare organization in the UK, for example. The mission might be to provide excellent care for everybody in its services and help them to achieve more, something like that off the top of my head. But that generally isn't enough for a candidate to want to join the company or to want to stay. So the EVP is more about trying to articulate what's in it for candidates. There's a lot of research out there, which is easy to find, which will show that, especially in the current climate, that candidates, they want to know what it's like to work for a company more than ever before. So if we're clever as employers, what we would do is we'd put that kind of content on a plate for them. Otherwise, they will go searching for it, and they might end up on social media or on review sites, which we all know is not always the most positive experience, depending on what you've got on there. And I think that with defining your EVP, it's not just about understanding what the proposition is. So an EVP, a good example is the armies. So be the best, one that everyone's probably heard, is a good overarching proposition. But as part of an EVP, which I think is a process, is trying to understand what it is that we're promising to candidates versus what we actually deliver. So it has to be true, it has to be real, because if it's not, if we go out to the market, we say, we offer great career development opportunities, but we actually don't, then what you'll see is you'll higher attrition, you'll see people bouncing out. So your unwanted turnover will become a problem and is a problem right across the industry. Once the proposition and promises have been defined, an EVP, a good EVP then gives you a messaging framework. So this helps you articulate what the messages are, how you communicate those promises to your target audience. An EVP isn't, in my book, an employer brand. An employer brand is different. An employer brand for me is where you bring your EVP to life. There's no better way of telling your story as an employer than having people who are actually doing the job right now telling that story. So I think this is the real fun bit of this process, is bringing to life your EVP, working with people doing the job, bringing that to life by creating content. That could be video, it could be podcast, it could be just the creative that you do in a way that is going to resonate with your target audience. And then what we all want them to do is to follow through with the call to action, which more often than not is to register their interest and apply for a job. So I think for me, an EVP is a real integral part of what we're all trying to do. And without it, we run a risk of getting across the wrong messages and inconsistent communications. And the final thing that I would say is that a lot of organizations who go down the route of defining an EVP, they have it sit in their talent attraction pot, if you like. So an employment life cycle goes all the way from attracting someone through to onboarding, application, pre-employment, all the way through to people starting, in fact, all the way through to people leaving. And your EVP really needs to run through all of that journey so that we're constantly rehashing it and kind of getting across what it is what's in it for the candidates, what we actually promised. And then even when you get to the end and people are leaving, did we deliver what we promised? And if we didn't, then we should put that back into the beginning of the cycle and evolve your EVP once again. So that's probably my definition of an EVP.
Thanks. No, thanks, Rowan. That was really comprehensive. What I will say as well, I forgot to say at the start, is if you've got any questions, please do pop them into the Q&A, kind of all the way through, and we'll do our best to get to those. I know people on webinars will say, put your questions in, and then no one ever asks them. So we will keep an eye on that, and the wonderful Jude at Tribepad HQ will pop those through for me as well. So please do stick anything you want answering into the Q&A as we go along. Paul, you've obviously very recently kind of taken part in a massive, huge kind of rebranding project, which I imagine EVP was a kind of significant part of. Would you mind telling us a bit about that, kind of what you looked at to start with, and how you kind of built that into the launch of the HCRG Group?
Yeah, sure. Thanks, James. So as you touched on in the intro, back in December 2001, we were acquired, and pretty much overnight had to do a full rebrand exercise, stop using our old brand, and that involved, from a recruitment point of view, having to redo all of our careers website, all of our job adverts, and straight down to the branding of all of the emails and everything that we use in Tribepad. And that was a huge piece of work for us. What we were also really conscious of was, at that point in time, we were coming out of the back end of the pandemic, and the expectations of candidates and what they want had really changed. So if I think back to pre-pandemic, in our previous brand, we were one of the first healthcare providers to really set nurses up for mobile working. So everyone had iPads, mobile phones, but actually post-pandemic that kind of became the norm. So what we wanted to do, and what we were quite lucky to have, is we've got a brilliant in-house marketing, brand and comms team. And we worked really, really closely with them, and did a lot of research, and they led a lot of research speaking to our colleagues to try and look at both qualitative and quantitative reasons to understand, actually, is our EVP still up to date? Are our adverts still up to date? And does it kind of reflect what current and future candidates want? What we did is our brand and marketing team spoke to lots of colleagues across all levels of the organisation, to recent joiners, people who've been with us for a while, and people who attribute to us as well. So we've got a really broad range kind of views in there. And I think as we were going through that, one of kind of the key lessons we learned was, if you ever go through these exercises where you look at your EVP, as well as getting the experts in to kind of do that research for you, as a recipient of what those experts find, is kind of be ready to be surprised. So there was some things in there that I kind of expected to see. So we're in health and care. So we know that people join because of people. We know that they're genuine and caring. But actually what we're seeing is some of the benefits and some of the attraction materials that we used had moved on massively. So things were coming out in the research that maybe where previously we pushed mobile working, flexible working an awful lot. Actually, what was becoming more important was knowing that there's things like there's free parking, there's free tea and coffee, and never would have expected some of that to kind of come out. If you'd have asked me what was important, I'd almost would have thought there were kind of hygiene factors that people had become to expect. That could be driven by different things. It could be driven by the cost of living crisis. It could be driven by inflation and where we're at today. But I think being prepared to be surprised by what you find is definitely one of kind of the key lessons that we found in that process.
Fantastic. No, that's great. I mean, some of the do's and don'ts, Paul or Rowan, some of the do's and don'ts around kind of EVP, if organisations are just kind of thinking, okay, how are we going to go about doing this? We'll ask what our employees want, but any kind of tips around do's and don'ts would be great.
Yeah, I think definitely for us, it's kind of be genuine and authentic, and try not to broad brush. So we run a really wide range of services. And when you try and have boilerplate kind of benefits, perks, T's and C's and culture things in an advert, it's not always the same in every team, and nor can it be. So I think one of the things that came out quite hard for us is we promote a lot of flexibility, but some of our teams don't always have the same level of flexibility. So to be really genuine and authentic in your adverts and in your engagement with that candidate around what isn't available to them and why, it is definitely one of the most important things to be able to do in that space. I think as well, when you kind of get to the point of advertising, is trying to listen to what people are telling you in the words and kind of in the context, and try and represent that through the brand and the marketing materials. One of the kind of the new adverts that we tested showed that we knew that people joined health and care because of people. So we brought our people to the front of our kind of attraction adverts. We used their words and we used their signatures in the adverts. And what we kind of saw with that is, when we did a kind of test sample, is even though we put the same amount of kind of money behind it in terms of a social advert, is I think the interactions and the impressions it made went up tenfold. So definitely by being authentic, by bringing your people to the front and not having it as kind of some HR marketing spiel, because candidates are onto that now. They know when it's corporate speak, they know when it's not real, they know when it's kind of photo stock, and making it authentic is definitely one of the key things that we learned.
Brill. Rowan, any kind of key do's and don'ts kind of, do you think?
Yeah, so I've got a couple really. One just from experience, which is sometimes when when you do an EVP, so it's a bit of a standout project and people get excited about it. Some people don't quite understand what it is you're trying to do. And if you don't have a plan for what you do after you've got your EVP, it's a bit like when you're playing football and you have, you play a great through ball and you're like, oh yeah, look at that for a pass. And then, the ball bounces back your way, but you're still looking at what a great pass and you miss out on the follow-up. It can be a bit like that. And it's the same with anything, to be honest, when you're working in a busy environment, even if you create that great employer brand video, but don't actually have a plan about how you're going to deploy it and cut it up and use it on social, etc. I think that's often a mistake. So the amount of organisations just recently that I've spoken to who I speak to, and they've got an EVP, but they've never done anything with it. And then, very quickly, if you've not got your EVP and you're moulding it and evolving it and validating it constantly, you can lose touch. So when I was at Signet, every meeting that I had in a hospital or in one of the care homes with staff, always in the back of my mind, I'm just testing that EVP. Is it still relevant? Are these things still the things that motivate you? And are these the reasons why you stay? The other thing is when you've got a research-based EVP that is bang on, it means that you just have this confidence that what you're saying out there in the market, it's based on research. It's like data wins arguments, right? You know this by having an ATS. If you've got the data, no one can really argue with that. So if you've got a properly researched EVP, you do know what you're saying, and it's a real good kind of foundation for everything else that you do. And the other kind of do is just building out what I'd said earlier, really, is that it can be a really engaging process. So like Paul said, he talks to people from all over the business, but it's a really good way to kind of, sometimes in healthcare organisations, probably every organisation, you have a bit of a standoff between ops and central functions. And, there's a lot of blame game, a lot of defensiveness, and sometimes a bit of giving up and all that. But doing a project like this, if you do it in a really kind of inclusive way, it actually promotes like a shared ownership over the issue or opportunity around staffing. And to get an EVP or an employer brand that just brings to life what everybody's doing, you get a couple of things. You get kind of universal buy-in, which is brilliant. But you also get people sharing stuff on social. So the amount of times, again, in the past where I've gone, here's your social media toolkit. Can you share this on this channel, on that channel? And it doesn't happen. Create content with the people in the services, and it happens without you asking. So I think, two things just to follow on from that. One is really embrace an EVP, employer brand project. And the other one is it doesn't need to be a hugely expensive project. It really doesn't. There's a lot of stuff that you can do in-house. Yes, bring in external companies, etc. But there's a lot of stuff that you can do in-house and be part of that to help really drive costs down and make it so that you own it much more.
Great. No, fantastic. Brilliant. So, yeah, as I say, any questions as we go through, pop them in the Q&A. I'll ask the gents those as soon as they come through. Brilliant. So I think we've had a really good session and a kick around of EVP. So moving on to our next title, which is around creating teams with fantastic processes and building teams with fantastic processes. And this obviously also relates to, I think, we've talked a lot about around kind of COVID and the pandemic as well, because obviously we went into COVID, we were doing things one way, we went into COVID, obviously huge restrictions, we were kind of forced to do loads of things differently, and now we've kind of come out of that. And I think there's been a lot of people in the sector, and probably cross industries, across sectors, it's not just true with health and social care, thinking about how do we take maybe the things that worked well during COVID and implement them now that we're in we're kind of back to meeting people and everything else. So I think, Paul, we'll come to you to start with. I mean, how have you found kind of finding that balance in recruitment and your teams and process flows and everything else kind of post-COVID, and what have you kept and what haven't you? And tell us a bit about that.
Yeah, I think what's interesting is reflecting back on the pandemic is when we had to move everything virtual and digital overnight. I think every recruitment team in the world did an amazing job of actually how do you take what is a human and people first process and make it digital and make sure that you've still got staff and colleagues joining the organisation and you continue to operate. as the kind of restrictions started easing and as we started getting back to the real world, what became a real challenge though was trying to actually identify what is it we want to keep and what is it that we want to kind of get back to human first. And if we think about earlier on when we just talked about our EVP and some of the research, actually what we really identified is people join people. So I always think that trying to get into that human interaction, that's when you can get a really good sense of kind of what's the culture here. So for our candidates that can come around, they can have a look at the hospital or the service they'll be working in, they can meet the manager, they can interact with patients, and that's a really important kind of two-way process, both for the candidate so they can see what it's like, also for the hiring manager so they can start to understand actually what does this person interact like, do they look natural, do they look comfortable? And what we really went through is actually trying to understand where is the major benefit from keeping the human interaction, and what we found is trying to focus on actually the moments that matter for the candidate. So that selection process, that interview process, getting them in front of people, they were the bits that we were really keen to make sure that we try and get back to in person and doing that as good and effectively as we can. When we got to what we want to keep digital, actually overnight we had to move a lot of our processes away from lots of horrible manual spreadsheet trackers and try and get to a way that worked for when we were all working remotely or working kind of in our spare bedrooms. And we really focused on how do we get the most out of kind of the systems that we had, and in particular Tribepad, and how do we focus on what we're good at. So we're good at recruitment, that's what we do, we are recruiters. So what we try to understand is how can we work with our partners who are specialists in different areas, and what can they do to support us. So things like when we started to look at how can we make references more effective, how can we make DVS and right to work checks more effective, we thought rather than us try and recreate that whole wheel, trying to go and find different partners and fit them into Tribepad, started working with the Tribepad ecosystem. That was really easy for us. It was a quick call to our account manager. And overnight, we started integrating all of these processes that we just didn't have to worry about anymore. That had a real big benefit for us, thinking about our old world. We managed to get our onboarding timelines down from 45 days to around 17 by actually letting the experts that we know focus on how we get our technologies and processes working back together. And the capacity that gave us allowed us to then focus actually on adding more value back into the candidate, making sure that for our candidates who are in onboarding, we could give them kind of weekly updates as to where they're at. And that's how we try to differentiate what should we do digitally, what should we do in human, and actually where should we rely on our partners. And it was always about actually what makes this easier for the candidate. And I think particularly in health and care, I think you touched on a stat at the start, there's about 29% turnover in the sector. So the turnover is a killer, but that means there are lots of candidates looking for jobs. So if you can get that selection process right, you can make it human. And then particularly for those of you in kind of health and care, you can make sure your compliance processes are running as slick as possible. That's only going to benefit you and your organisation massively.
Yeah, no, brilliant. Thanks, Paul. And Rowan, you're working with lots of organisations, and you obviously you actually rewrote the whole of your processes, didn't you, at Signet during kind of COVID? We're really interested to get your kind of thinking around that and how that kind of turned out.
Definitely. So I suppose this story goes back just before COVID. So timing was incredible, really. So we basically we wanted to pilot virtual interviewing. So we did it over WhatsApp. We figured everybody's got WhatsApp, and we did it at a couple of sites, and we saw that there were a reduction in turnover of 75% in some cases, which was just, at the time, incredible. So we were getting a lot of no-shows, as I'm sure that everybody's listening to this still does. Then we roll on a little bit, and Boris Johnson made his statement. We all got locked down. I personally got back about 16 hours a week that I was on the road, and then set about. I was thinking that just that one little tweak drove pretty impressive results. So I started reviewing our entire end-to-end resourcing process because for once I'd had a bit of time to do so. And basically spent my time drawing red rings around every single point where we could be there could be blockers, or where candidates might be dropping out of the process. I looked at every single candidate touch point. So every time that anybody who's involved with the resourcing process would come into contact with a candidate, what we were sending them, how we were sending them, how quickly we were sending it. It was a really interesting kind of process that I went through. What I then went on to do was kind of rewrite the process. Like I said, put KPIs behind it, and that was for hiring managers, it was for the in-house recruiters, the onboarders, etc. Basically trying to understand how we were actually going to measure any changes that we were going to make, and it did actually all come together. And interestingly, because after COVID, everybody here will remember there was a mad influx of candidates. It was like, it was crazy. So everybody wanted a job. We had so many young people who came through with all the care in the world, and they were sailing through video interviews, getting jobs. But then later on in the year, it was like overnight almost, the recruitment market changed. So the way that candidates were applying for jobs changed. The quality of applications was going down. We had, lots of kind of international applications coming through, people ghosting us and not turning up to interviews, all that kind of stuff was happening. So I kind of reviewed the end-to-end resourcing process, but then I went on to review, how is it we're actually attracting candidates? So we're doing that in the right way? Because if everything's changed, why would we still do that in the same way? And in line with that, a lot of the costs went up, as everybody will remember. Some of them went up 200-300%. So me, I went on a bit of a personal mission to try and find how we would attract meaningful applications in a different way, which I know is not necessarily part of this, but it was all part of a big process. But I suppose that the key thing is, because I changed our process, really looked at it, it became a little bit more agile anyway. So that meant that we were able to change the way that we were attracting candidates. So I reduced advertising spend massively. I increased spending employer brand awareness in social media channels, etc. And we recruited 6,200 people, and we didn't use a duration listing in the last year that I was there. So it all kind of came together. Interestingly, I obviously, in my current role, I speak to a lot of healthcare, social care organizations, big volume recruiters, and a lot of companies are still doing the same thing they did even pre-COVID. And since then, we've seen changes, lots of different changes. James, you'll know only too well, because you've got an ATS, the tech's been changing and keeping up with everything. But a lot of employers aren't, which is no kind of bad thing on their part. It's difficult when you're firefighting and you're constantly responding and reacting to beds blocked over here, growth site over here, etc. It's hard to take a step back and review your strategy and your process, etc. But my advice, just from personal experience, is do it, because and even if that means putting somebody in your team on that as a project, or bringing somebody external in to come in and review your process, review and just challenge what you've always been doing, I guarantee that in most cases you will come out with a competitive advantage, because other organisations just aren't doing that yet. Yeah. Anyway, sorry. Waffling.
Yeah. No, that was really, really useful. I think, we've all seen those changes, and the candidate market's become a lot shorter. The time that you respond to candidates, if they're making 4, 5, 6 applications, and you're the 5th or 6th organisation to speak to them, we know the chances of us getting them into our pipeline is that much more reduced, isn't it? So, thinking about how do we identify great candidates, how do we respond to them quickly? I talk to lots of organisations, and who aren't necessarily looking at that KPI of candidate coming in versus the review and then the contact kind of straight after. So a lot of spending thousands of pounds with job boards, and maybe even bringing the candidates in, but not getting to them fast enough in order to engage with them and bring them through.
Do you know what, James? I think you're absolutely spot on with that, because one of the things that we work with our clients now, well, let me just rephrase that. A lot of what happens in the market, in the attraction market, it stops when you've got the candidate to the door. So there's a lot of talk about clicks and impressions and applications and volume. Not so much about A, quality, and B, what happens after you've got them in. So I've got an analogy, easy for me to say, that I've used a couple of times. It's like a candidate's like a fine piece of crystal, right? And you do all this work at the front end, and you've got this fine piece of crystal. It could be a mental health nurse, and you've got it, and you're passing it on to a recruiter. Now, if that recruiter sends an email and one phone call and then says that candidate not contactable, you may as well get that piece of crystal and just chuck it over there and hope it doesn't break, because candidates are applying for 10, 15 jobs in 5 minutes, one click apply, all that kind of stuff. So the recruiters need to think about it in a different way and be more creative. If you do get through that part, they're passing that bit of crystal on to a hiring manager in some cases. Some are brilliant at interviewing and some might not be so good at interviewing. And if you get through that stage, you're onto an onboarder and so on. And there's so many opportunities for that bit of fine crystal, that candidate, to be dropped and just move somewhere else. That I think that there is a real need for a mindset change for everybody who's involved in the recruitment process. So there's lots of in-house recruitment teams who've got brilliant people with great customer service, but it's just thinking, actually, the candidate market has changed and the candidates might not know what they've applied for. Probably don't, because they've applied for loads of jobs, but that's the way it is. So we have to change with it. We've got to change our processes, our techniques, and also the way that we're thinking about what we do with candidates once we've got them, and to help them stay.
Yeah, no, that's a great point. I think we've talked about, haven't we, how there's no point cutting your nose off to spite your face, kind of saying, look, I want a full CV from a candidate. Well, if they're just not willing to give that, I'm afraid, we've got to deal with the situation that we're in and adapt to that kind of that place that we're in. Paul, your recruitment team, obviously done fantastically well. I got a lot of praise for those kind of process changes and recruiting some great numbers. Couple of kind of top tips, would you say, things that have really kind of impacted for you and your team?
Yeah, so I definitely say one is start today. So it's taken us 2.5 years to get to the point where we've got onboarding from 45 days to 17 days, where we're bringing in, we're growing the workforce by 200 people a year, and that's been a really, really long journey. I think in previous lives, in previous employments, we've probably tried to do this as one very, very big project that takes forever and is constantly changing. What's actually worked for us really well here is doing small incremental changes, having an end goal that you want to get to, but trying to get there in a kind of more practical and pragmatic way. So kind of just a couple of examples to bring that to life. I think our contracts 2 years ago maybe had 26 clauses in it that maybe we needed to change for each and every candidate. Kind of took us about 30-40 minutes to produce one contract, and we knew we wanted to get to the point where a system could generate them, or a robot could generate them, or somehow they were automated. But we knew actually today we can make that contract better, and the team will feel the impact of that contract. And when we get to the point we can automate it somehow, it'll just be so much easier. So starting today and kind of going really small. And I think growing on from your point as well, James, it is making sure that you're trying to keep the candidate in the heart of this. So for some of our volume roles, we've seen great impact by turning on kind of quick apply. Our previous ATS is about 10-15 minutes, non-mobile friendly way to apply with horrific drop-off rates. So just kind of going to quick apply, getting the candidate's basic details and making sure that you've got a recruiter on the phone to them within 24-48 hours. They're all kind of things that you can do today without having to set up huge program and governance around it. So that kind of small incremental change is kind of definitely one of the key messages that I would share.
Fantastic. No, that's brilliant. So yeah, just to say to everyone, please do pop any questions in you have for Rowan and Paul. We do have a question. Thank you very much, whoever popped this one in. So the magic word authentic keeps appearing. How would the panelists define what this means and how to achieve it? How would you define authentic, and yeah, how do you kind of truly achieve that kind of coming across to your potential applicants? Who wants to go first on this one?
I can go first. So what I would say is make sure that you're not just sat in a room with your recruiters coming up with really good strap lines that when someone kind of hits the ground and starts the organisation, it doesn't resonate in any way, shape or form. And trying to make sure that your actual culture and values come out in that. So as an organisation, we exist to change and transform healthcare. So we do lots of transformation of different healthcare services and different ways of doing health and care. And actually making that really apparent for our candidates, it was a really important thing that came out of our EVP research. There are people who don't want to work in a change environment, and there are also people who want to work in an environment that's changing, necessarily don't want to drive that change. And I think making sure that you've got that balance is really important, and that the adverts that you do are represented then through your selection process and through into your induction process, and that it feels consistent and something that you can say and stand behind and say, actually, this is our true self. It's not an organisation, or it's not rather an effort organisation. It's something we genuinely believe in.
Fantastic. Bro, Rowan, anything to add to
that? Yeah, I suppose one thing that I experienced, and it's kind of just like a light bulb went off one day, is that we'd gone through the process of doing an EVP project. So we have, research-based method that works across the whole of the business. But again, this is at Cigna. When I went to visit a site, each one of them could have had their own EVP. And it blew my mind for a little bit. So I was thinking, if they all have their own unique proposition, we have got a one-size-fits-all, but how do you tie that in? And again, when going through the process of bringing to life that EVP for a particular site or location or job family, if you allow yourself to get a little bit creative with it, make sure that it's real, but it really hones in on that site. So sometimes, to be authentic for everywhere, it is a challenge, but there's no reason why you can't kind of drill down. And the other thing is kind of what I mentioned before, which is when you're using the people who are actually doing the job to bring to life your EVP. So you've done your research, like Paul said, with the people. It's not just your HR team or an external company saying this is what you should be saying, because it's really difficult. We're all in healthcare. We're all, let's be honest, trying to say we're here to make a difference, because that's what we are here to do. And it's the same in other sectors like housing. We are here to make a difference. So how do you get a unique proposition when you're trying to say the same thing? It is doable. But the authentic side of it is you've got to be able to deliver what you promise. And that's a case of, speaking to your employees, what motivates you, what really truly motivates you to join and to stay. And then taking those motivating factors and taking them to your hiring managers, your senior leadership team, saying, right, these are the motivating things. Can we deliver against them? And if you've got 20 things that motivate people, we can only deliver against 10. Focus on them, not any of the others, because people will just bounce out and you would just have retention issues.
No, that's brilliant. Yeah, it reminds me of in a past life of being a recruiter, and when we used to bring candidates in for interview, they would take them into the really nice room, and be really high, and then kind of when they start, they'd be in like the porter cabin at the back. That was a completely different experience. I had another question as well, so thank you, Phoebe, for putting this question into the Q&A chat. Please do add one in. It's not too late if anyone wants to add one in. Tips on how you can implement that EVP like across the business. So I guess not just make it part of the recruitment function, but how do we communicate that out so that people are kind of living and breathing our EVP, I guess. Any Paul, do you want to go for that?
Yeah, I can do that. So I think this is a really important point, because it's not a true EVP if it's just used in recruitment, and it kind of stops at the point you've had your job offer come through.
Yeah.
The advice that I would say, and I think I'm really lucky because we have a really great brand and marketing team, it is to really work hand in hand with them to make sure that you can start getting it across all of the touch points that you possibly can. And to try and, again, go back to the point, is start small and just kind of keep that drumbeat going. So we did start at the recruitment point of view, but we're now starting to bring it through into other areas, such as kind of into our induction, into some of we have annual award ceremonies and colleague feedback ceremonies. And we're trying to bring it through kind of more gradually rather than this big bang, get out the door. But for me, it's definitely engage the experts in your organisation.
Brilliant, yeah. So organisational, ceremonies, newsletters, just kind of picking on those points and highlighting those points kind of throughout the organisation. Brilliant, fantastic. Well, we've rapidly motored along there to 40 minutes. So unless anyone pops a question, a last minute question, thank you ever so much, Paul and Rowan. Really, really appreciate it. Pleasure. Hopefully that content for everyone watching was really, really useful. Please do find us on LinkedIn and follow us and follow up with any conversational questions that you might have on reflection after this webinar. There will be an email coming out to everyone that's attended, giving you a few more details. But yeah, for now, thank you so much everyone for attending, and I hope to see you again soon.
Thanks everyone.